Hi guys!
Welcome back to our channel. I'm Maan.
And I'm Banin.
And we'll be your PT students for today. So for today's vlog, we will be showing you a new case which is all about the acute ankle sprain.
And we will be showing you a step-by-step process. So the first one is tissue preparation,
Therapeutic exercises,
cool down,
and the outcome measures.
So what are we waiting for? Let's get in with the video.
What is ankle sprain? According to the American Academy of Orthopedic Surgeons, an ankle sprain occurs when the strong ligaments that support the ankle stretch beyond their limits and tear. Without proper treatment and rehabilitation, a more severe sprain can weaken your ankle, making it more likely that you will injure it again. Repeated ankle sprains can lead to long-term problems including chronic ankle pain, arthritis, and ongoing instability. Rehabilitation exercises are used to prevent stiffness, increase ankle strength, and prevent chronic ankle problems. The goal is to increase strength and range of motion as balance improves over time. Before you start, make sure to ask if there is still pain and take the patient's vital signs. For the tissue preparation, we will be using hot moist pack. Heat increases circulation and raises the skin's temperature. For these reasons, it should not be applied to acute injuries or injuries that show signs of inflammation. Heat is great for sore muscles and joint pain, which are typical for chronic injuries. Heat should be applied before exercise to increase flexibility and to stimulate blood flow to the area, and it should be applied no more than 20 minutes, and be careful not to burn yourself.
So we'll be starting off with active range of motion and passive range of motion of ankle dorsiflexion and plantar flexion. Range of motion is a basic technique used for the examination of movement and for initiating movement into a program of therapeutic intervention. Active range of motion is 1 to 3 sets of 15 repetitions 3 times a day. Passive range of motion is 3 sets of 10 with 3 to 5 seconds hold at end range with care taken into the direction that will stretch the sprained ligament. Next is Achilles tendon towel stretch. This can also be performed using a gait belt for 15 seconds, 5 times a day, or 30 seconds, 3 times a day. The next exercise is resisted range of motion exercise with an elastic band. But if you don't have an elastic band, you can use a gait belt. This is a test for inversion and eversion. So this is for 3 sets of 10 to 15 repetitions with the goal of achieving muscle fatigue at the end of 3 sets. This progressively increases the range of motion, duration of holds at the end range, and resistance level of the elastic band over time. This will increase the resistance, for example, the stretch of elastic band, when 3 sets of 15 repetitions are completed in full range. The next exercise is weight-bearing Achilles stretch. This is for 3 minutes, 3 to 4 times a day. Progress to standing stretches for gastrocnemius, which means the leg is straight, and the soleus, knee bent, with 3 stretches of 30 seconds duration. Next is self-mobilization of the ankle. Self-mobilization can also be done in a standing position, maintaining a short foot, bending the knee and passing it in between the 3rd and 5th toes toward the wall without picking up the heel. The joint is mobilized by rocking back and forth, forward, and stay away from the wall. And lastly, for the therapeutic exercise, side-lying resisted hip abduction exercises. This is to activate the gluteus medius, which sometimes becomes inhibited in ankle injuries. If necessary, start with clam exercise, hip abduction with both heels on the floor. Progress to single leg raises, hip abduction, while lying on the side. Add resistance to with ankle weights if necessary. The heaviness should be 1 to 3 pounds, 3 sets of 10 to 15 repetitions. After exercise, ice is the best choice for a chronic injury because it discourages the onset of swelling and pain. For the outcome measure, these include the Foot and Ankle Disability Index, Foot and Ankle Ability Measure, and Foot and Ankle Outcome Score. You should always ask the patient also for the pain scale.